Compulsory licensing. Compulsory licensing is the government of a current country allowing a particular pharmaceutical company to produce the cheaper versions of a patented drug, keeping in view of the public health of the country. So is it illegal? No, it is legal as per World Trade Organization's trade related intellectual property rights agreement, which was came into force in 1995 January. So compulsory licensing is a process wherein the government of a country allows a particular pharmaceutical company to produce the patented versions of to produce the cheaper versions of a patented product. Why is it in news? It is in news recently because there will be a political declaration adopted by the member countries of the United Nations General Assembly, which this political declaration aims to eliminate tuberculosis by 2035. So for effective elimination of this TB, generic medicines are very important because the affordability and accessibility of a drugs play crucial role in eliminating of the TB menace. Okay, under these trade related intellectual property rights, the developing countries and underdeveloped countries can manufacture cheaper generic versions of the costly patented drugs. So why is it the facility has been allowed in TRIPS under WTO? So since essential drugs are the matter of human rights, not only for business purposes, essential drugs are a matter of human rights, so that they must be universally made available, that is accessible to everyone who needs them. So through compulsory licensing, countries can ensure that patents do not impede the protection of public health and the life-saving drugs were accessible to larger populations at a cheaper and affordable prices. This is the motto. So let us see the background for this compulsory licensing. Compulsory licensing was a provision allowed under TRIPS into 1995 agreement, and this also has been emphasized under 2001 Doha Declaration also. So India used it for the first time the compulsory licensing provision in 2012. Under this, the government of India allowed NATCO Pharma Company of India to produce generic version of anti-cancer drug Nexavar, that is also called as sorafenib. This Nexavar drug was produced by German company Bayer. So and also a year later, Supreme Court rejected a patent of the Swiss drug maker of Novartis, which used to manufacture an anti-cancer drug Glyvec. So these two drugs, Glyvec and Nexavar, has been irritants between the global pharmaceutical companies and the Indian pharmaceutical companies. Since Indian government allowed the patented version, allowed the manufacturing of the cheaper generic versions of these patented drugs. So by all these incidences, US was very angry and it ranked India at the bottom third in its GPIC index. So not only the Indian companies which manufacture cheaper generic drugs that we have to know, but are also what are the laws that supported this manufacturing of the generic drugs is Indian Patents Act of Section 3D prevents the evergreening of patents unless it differs significantly from the properties with regard to efficacy. So the Section 3D of Indian Patents Act also prevents the evergreening of patents. What is this evergreening of patents? So getting patent for 25 years and again getting patent of 25 years like that, without any significant difference in the formula or chemical formula of the drug. So only with respect to efficacy, then we will allow this facility. Not only India, let us see what are all the other countries. So like developing countries like India and underdeveloped countries which uses this provision, compulsory licensing, keeping in view the public health care as a concern. So South Africa, Rwanda, Brazil also lowered the prices of antiretroviral drugs. Antiretroviral drugs means which aim to prevent AIDS. And also Thailand lowered the prices of drugs to treat heart diseases and various forms of cancer. So since these are all the very costly treatments, cancer, heart diseases and ART, antiretroviral therapy, so usually these drugs will be lowered prices, keeping in view the health hazard of the public. And now recently which is in use is TB, tuberculosis. This is also a health menace which India aims to reduce TB below 2025. But as per world conventions, it has to be reduced by 2035.